There is an immediate cost to losing a tooth, usually manifesting as the smile tax, that instinctive urge to cover your mouth or practice a closed-lip smile during everyday interactions. Many patients assume that if the gap has healed and the pain has stopped, there is no urgent reason to act. Teeth belong to a living, balanced suspension system that relies on constant pressure from neighboring teeth to stay upright. This flowchart illustrates the biomechanical collapse that follows the loss of a single tooth. Without a middle support to hold them back, the teeth on either side of the gap begin to tilt inward toward the empty space. Simultaneously, the tooth directly above or below the gap loses its biting partner. Because it has nothing to hit, it overgrows out of the gum line searching for a solid surface, a process known as supereruption. This combination of tilting neighbors and overgrowing teeth eventually throws your entire jaw out of alignment. Stopping this collapse requires a choice between two modern interventions, a fixed dental bridge or a dental implant. Leaving a gap untreated guarantees structural decay, eventually forcing a much more complex medical intervention. This matrix breaks down the physical trade-offs of both options, beginning with their mechanism and architecture. A dental bridge functions like a suspension bridge spanning a river between two solid pillars. To create those pillars, the clinical team reshapes the two healthy teeth on either side of your gap. These are the abutment teeth. A sculpted ceramic tooth is permanently fused between these capped abutments to fill the void. This provides non-surgical stability, though it involves removing natural enamel from the adjacent anchor teeth. A dental implant takes a standalone approach. An implant is an artificial titanium root surgically placed directly into the jawbone. It leaves the neighboring teeth completely untouched while requiring a minor surgical procedure. The decision involves a direct trade-off between biological preservation and avoiding surgery. The timeline highlights the sharpest contrast between these two procedures. A dental bridge follows a 2-visit digital workflow using precise lab-fabricated impressions. You walk out of the very first visit with a high-grade temporary bridge already in place. Roughly 14 days later, the final ceramic bridge is permanently cemented. The dental implant timeline is dictated by the requirements of biological healing. Before a tooth is attached, your jawbone must physically fuse to the titanium post through a process called osseointegration, which takes 3 to 6 months. Both options use modern ceramics that mimic the light-reflecting properties of human enamel to ensure a natural appearance. The fixed bridge resolves the smile tax in 2 weeks rather than 6 months, making speed the defining advantage over an implant. We conclude the matrix by evaluating the long-term maintenance required for these investments. Implants can be brushed and flossed exactly like natural teeth. Because a fixed bridge connects 3 teeth together, traditional top-down flossing is not possible. You will need a floss threader to slide the floss horizontally underneath the suspended tooth. This daily routine prevents gum disease from compromising the anchor teeth. Committing to this specific hygiene routine allows this bioarchitecture to function for up to 15 years. Selecting the right restoration depends on your personal lifestyle and biological constraints. This scorecard categorizes the 2 paths, the fast tracker and the biological optimizer. The bridge is often the choice for those with a strict life deadline, high anxiety regarding surgery, or adjacent teeth that are already heavily filled. If those adjacent teeth already need crowns, the bridge serves as a highly efficient restoration for 3 teeth at once. The implant is typically preferred if the neighboring teeth are pristine, you are comfortable with minor surgery, and you have a patient 6-month timeline. This path prioritizes standalone structural perfection and biological conservatism above all else. Both implants and bridges provide sophisticated restorative engineering tailored to different patient needs. Whether you choose the immediate speed of a bridge or the standalone preservation of an implant, restore the gap before your jaw's architecture fails.